Good evening, everyone. Welcome to this event on COVID and your mental health, sponsored by the League of Women Voters of Hillsborough County. My name is Deborah Kaufman, and I am president of the League. Before we meet our distinguished panel and dive into this very important topic, I would like to provide a little information about the League. The League of Women Voters was founded over 100 years ago, shortly after the passage of the constitutional amendment granting women in the United States the right to vote. It was then and continues to be a nonpartisan political organization committed to educating voters and advocating for important community issues. These two separate but equally important functions help us to achieve our mission of empowering voters and defending democracy. Membership is open to all persons 16 and older, and becoming a member locally automatically makes you a member of our state and national leagues. If you are interested in joining us, please indicate in the chat and we will contact you with information. And now for a bit about tonight's topic and our guests. Access to health care can be challenging for many of us, and access to mental health care is even more challenging. Dealing with mental and emotional illness has only been made worse during the COVID-19 pandemic, particularly in families with children, but also for those of us with no children at home. Tonight, we welcome a panel of speakers who are knowledgeable about the treatment of these illnesses and about the opportunities we have in our community to access these vital healthcare services. Now it is my pleasure to introduce a member of our board of directors and the co-chair of our Healthcare Action Group, Angela Birdsong, who will provide the meeting ground rules and introduce our speakers.
Good evening to all, and welcome to a webinar that we're so proud to present. How we're going to work it this evening is you will be allowed to ask questions, but please place them in the chat. You're going to be muted throughout this presentation. We have some awesome speakers who've decided to join us. And they're all local, so you're going to get a lot of information and you can talk to these people. You can even maybe visit with these people. So the first person we have on board is Sunny Hall, and she is the Vice President of Client Services for the Crisis Center of Tampa Bay, about to celebrate their 50th year serving our community. She supervises sexual assault services, gateway services, and she's part of the Corbett Trauma Center. The center is a community leader in the implementation of trauma-informed care, both in service delivery and in organizational culture. It provides services using successful national evidence-based models. And Sunny is a 25-year veteran of child welfare services in the Tampa Bay area. We are so happy to have her. Our second speaker this evening is Natasha Pierre. Not only does she happen to be gorgeous, she's also very qualified. She is the Executive Director of the National Alliance on Mental Illness, also known as NAMI. She's an award-winning speaker and author, certified professional career and life coach, a mental health advocate with over 20 years of lived experience in the community. Now, our next speaker is Alan Davidson. He is the Chief Clinical Officer of the Central Florida Behavioral Health Network. He oversees all clinical operations for the Suncoast 14-county region. Clinical operations include state hospital forensics, mental health, substance abuse, prevention, utilization management, and special projects. Most of the work he oversees intersects directly with child welfare. He is also a licensed mental health therapist. Over the course of Alan's career, he has worked in a range of settings, including community, mental health, children's group homes, and with insurance companies. So I'm sure you're going to give them a round of applause right now, even though it may be silent. But here is Miss Sunny Hall.
Thank you, Angela. So I just want to say out loud that Alan is just been made a doctor and Natasha is gorgeous and brilliant. So I would like to be stately and wise. Perhaps we can find some words that I can adopt for myself. Um, and we'll talk about that later, Angela, and figure out what you're going to call me next time.
Okay.
Thank you. Okay, hi everybody. I appreciate the opportunity to speak. I'm not. I was saying earlier, like a lot of people, I'm not great on this kind of platform. I like to be in a room with people, and if I talk too loud or too fast, and I don't know where to look, so I'll just be looking around, or maybe I look at myself. I don't know, but I do want to give you some really good important information. So I am happy to be here, and I'm happy to have this opportunity to do this. As Angela mentioned, the Crisis Center has been around for almost 50 years. As we were talking before we started, we started as a crisis suicide hotline. We morphed into a call-in crisis line and adopted the nurse examiner program for sexual assault. And then through the years have just acquired many services, tried different things. And I think in the last probably 10 years, we've really honed our focus and our mission on ensuring that no one faces crisis alone, that we really focus on the idea that what is crisis to one person is different to another, but crisis it affects everyone at different times of their life. And so how do we respond to those crises? How do we respond to the daily things that challenge people? And then what are the services that we will focus on and continue to bring to the Tampa Bay area? So I'm just going to touch on some of those services, and I'm going to give you, while I touch on the service, I'm going to talk about COVID and what happened and what we've seen with COVID, and some of the things that we have had to pivot. I guess that was our big word for the year, was pivot. We were constantly pivoting. Felt like a dance at one point. I think it's important to know that, we take ourselves very seriously. So we never close, never 24/7. The only time that we've closed in the 10 years, almost 10 years that I've been here, was one of the hurricanes that was supposed to come through a few years ago. And we had to literally evacuate the building. We shut our call center down for about 6 hours, but a call center in California took our calls for us. So, that's the only time. And when COVID came, we said we were not going to be able to close. We don't want to close. So we did a lot of remote work, a lot of hybrid work. And I think the most prominent service we provide that most people know about is 211. And so if you dial 211 in Hillsborough County, you're connected to the crisis center 24/7. And even our 211 staff, the people in that department, we have never had them not work in the building. And so we had to try to put all of them remote for a while. And then we, as quickly as we could, we started trying to bring them back and putting them all across the building while the rest of us stayed out of the building. And why that's important is in the first, probably like in February, 211, people were calling 211 for services. They were looking for, how do I pay my rent? I need emotional support. I need mental health counseling. I need, various things. I need medication. I'm a veteran. I need some services. And in February, those calls were pretty, the level was pretty normal. We were experiencing what we normally do, which is several thousand calls a month. And then in March, the first 2 weeks of March, those calls jumped. And then by the end of March, we had doubled our call rate because that was the time where we didn't know what was happening. And people were, when the NBA shut down, literally, we went back and watched that timeline, and when the NBA shut down, our calls spiked. It was almost like that was the tipping point for people. They realized this is serious, because if the NBA is not going to play, people aren't going to get paid. This is serious. And through that time, through the entire year, and even into the last few months, those calls have stayed elevated. Generally, people are calling about In the beginning, it was about anxiety, what's happening, and then quickly it turned to financial concerns, a lot of financial concerns. We were part of the project with the city of Tampa where we were able to give about 1,200 people $1.2 million in rent and mortgage and utilities. We did that in a period of 6 weeks, which is insane. I would never encourage anyone to ever try that again. But it worked and people got the help they needed. And then the calls began to change from financial need and rent to unemployment, and then it really went full board into emotional support and mental health. And what's interesting in that service is that we have several lines. We have a veterans line, and we have we had a COVID line for a while. Alan's company helped us put together an emergency COVID line so people could call and get some support related to what they were experiencing in COVID. But what was really astounding for me over the course of about 8 to 9 months, when we started looking at the data, we recognized that our suicide calls were going up dramatically. Now, we've seen spikes in suicide calls through the years. Some case in point, Robin Williams. When Robin Williams took his life, our calls went up, doubled, and really kind of only came down a little bit because now people are talking about it. People are triggered. People are willing to connect to someone to talk about it. Kate Spade, that was another time when the calls went up. During the COVID time, the suicide calls started going up, and they stayed up, and they're still up. Our suicide rate has increased by 20% over the last 16 months. And what was super alarming to us was that calls from kids ages 13 to 18 went up 36%. Suicide calls from kids ages 13 to 18 went up 36%. We have one of our programs in the 211 Gateway Center is called Youth in Transition. It's where a care coordinator, we call her a peer. We try to get them as young as we can, because we serve this particular group serves people up to 24 years old. So we have some young care coordinators working in that program, and those services, those requests for help from the kids up to 20, I call kids that are 24 kids. I mean, you get to a certain age, you can do that. Those calls went up 16% just in kids needing mental health and addiction and substance abuse treatment. So it was pretty dramatic. And then, as you know, during the year of COVID, I can't mention the year of COVID without talking about the social unrest and some of the issues that were happening related to Black Lives Matter and just some of the marginalization and some of the things that were happening in our country and just how anxiety provoking that was. And so when we looked at that data to see, how is that affecting our neighbors and our community, people, Black callers who were seeking mental health treatment, that spiked 25% over our average number of calls from people who identified as Black seeking mental health services or mental health support. What was interesting about that during that time is that calls from white callers went down. Mental health requests from white callers went down. Black callers went up significantly, 25%, and Hispanic and Latino, 16% increase. I say all that to say it's brought a lot of need, but everything else around what was happening, and now all of that is exacerbated by what's happened now with COVID, with the vaccinations, and then building in the social implications of that and what's going on politically. So that's just a little snapshot of what was happening, and it's still happening in our gateway services. We immediately began to, well, not immediately, as quick as we could, started to figure out, okay, what do we need to do to address this? How do we get my boss, Clara Reynolds, on TV as much as possible to talk about this? How do we find people to be able to represent the services that we bring so that people will know they can call us and they do find that someone is there on the other side of the line, listening, but not only listening, but giving support and actual practical coping skills and coping techniques to be able to manage so that they don't elevate to a high critical point. When they do elevate, we have suicide prevention. We also operate the National Suicide Prevention Line for Hillsborough County. So we take those calls. We have care coordination that provides ongoing services to people who are feeling suicidal so that we can, again, prevent them from having to go into deeper in care. Another interesting service during COVID was our sexual assault program. You know, when we first started needing to send people into remote working environments, we were concerned, you know, about how, you know, we want to make sure, that we're medically keeping people safe, our people safe. We have 24/7 nurses who are on call. We have advocates who are on call 24/7. We have about 14 nurses, most of them nurse practitioners that rotate through being on call. And then we have 8 advocates who rotate being on call. And so, you know, we didn't know what was going to happen. You know, what was going to happen. How are people going to find us? People were home, we're trapped at home. A lot of people in domestic violence situations, in situations where there are power-based violent issues happening frequently, and we wanted to make sure that when people needed us, they were going to be able to get to us. So we worked all that out so that we could be responsive. But what we found was that our sexual assault calls for a little while went down, dropped pretty significantly, and part of that has to do with a lot of the sexual assault intervention we do is related to people who meet people outside of their homes. They meet people, you know, in clubs, in bars, with friends' house, you know, at parties, at other places, and sexual assault. And so the sexual assault in the home is not necessarily as reported as such a level as sexual assault outside of the home. And just so you know, the rape crisis services that we provide, we have an on-site clinic here at the crisis center. So 24 hours a day, 7 days a week, people can come here. Law enforcement brings folks here, or people can come if they don't report to law enforcement and come to our center and have a confidential, safe, supported forensic exam where we collect evidence, we provide medical care, we provide prophylactic care for STDs. And then we provide advocacy and follow-up to make sure that the victim's needs are being met and that we can move that victim to a place of being a survivor. So what we found during COVID is, as I said, our sexual assault reports initially went down, but then they started to go back up. And when we started to look at what was happening around sexual assault, we found that we saw a 70% increase in people who met their assailant online. So people were meeting people online, and then they were going to physically meet people, and a huge majority of the cases we saw were people who were assaulted after meeting someone online. Now, we didn't anticipate that. We did not anticipate that, and so we began to respond to that. And a couple of the things that our advocates did to be proactive was to purchase a Tinder account, and to make that Tinder account active to the point where they would look for people around and be sure that they were advertising our services, that they were identifying that people were being sexually assaulted by meeting people online, and bringing that to awareness while people who were using the Tinder app. And especially, and we have advocates who live all around the county. So they were kind of, you know, stationed at their own homes doing some of this Tinder activity, because if I didn't know this, but I learned that Tinder identifies people who are near you, you know, in your surrounding geographic area. So now we're back in the clinic almost 100%, and all through it, we saw people at our clinic. We brought people in for exams. We were able to use all the protocols. Fortunately, we had a lot of outpouring from the community, so we had plenty of protective gear, PPE equipment, and we were able to provide the services without putting our staff at risk. And then our corporate trauma center is where our trauma counseling lives, and that was we expected to see a lot of calls for trauma counseling, and that has happened, not in the beginning. What was interesting is that in the beginning of COVID, people were really worried about everyday life. You know, they're worried about their jobs, worried about how to feed their families, worried about getting sick. And when that happens, many times people who are struggling with mental illness or struggling with trauma symptoms, the overall physical needs kind of takes control, right? They're able to kind of sit for a little bit and focus on those major needs. However, that's not sustainable. And after a period of time, you know, that begins to shake, and the mental health challenges and the emotional challenges begin to rise to the surface, and especially people who've experienced trauma. And I want to say this, people, we were talking earlier about what's happening in the world. People are angry, people are running over each other, their gun violence is up dramatically all over the country. And part of that, you know, in our opinion, is just what we've seen is that when people have experienced trauma, and listen, 78% of the people in this country have experienced trauma at some point in their lives, most of them as children. And we know that when you experience trauma as a child or even into early adulthood, that trauma literally physically impacts the brain functioning. It impacts how you respond to things emotionally, and those trigger mechanisms will create behavior that looks like mental illness, that looks like behavioral adjustment disorders in school. And so when people have experienced trauma and then something happens on a major level, like COVID, and it isn't like COVID for us was different than like a hurricane, because a hurricane comes, it leaves, it's one area, and we move on, and there's lots of help, and everybody's helping each other. This was across the world, and it lasted a long time, as you know. So people were triggered and constantly triggered. And as they're constantly triggered, those emotional responses, the things that are happening to them, they're being triggered by loss, resentment. 1 in 500 kids in our country have lost a caregiver. They've lost somebody close to them to COVID. And so there's a lot of anxiety. Kids in school are seeing teachers or teachers' spouses, you know, who are dying, especially in the last 3 or 4 months. I was talking to someone from Pasco County School System the other day, and the social workers have responded every week to a death of an adult in the Pasco County school system. And so that's what's happening to kids. And so those triggers then lead them to some acute needs related to mental health. In our counseling center, we knew we were going to need to have people available for counseling. We'd never done teletherapy before. We transitioned to teletherapy pretty quickly, probably within 2 weeks. We purchased equipment, we're able to set things up, get HIPAA compliant, and all those things that need to happen. And what we saw was a slight drop in trauma counseling appointments, but then we saw them start to go up, and they went up by about 32% over the course of the year from July 2020 until now. The other thing that was really great for us, because we are always battling this, was our no-show rate dropped to almost nothing. Our cancellation rate dropped to almost nothing. But then we realized after about 6 or 7 months that we were making progress with folks in their trauma recovery, because we focus on trauma recovery and use specific therapy techniques related to trauma recovery. We noticed that they weren't doing as well. So we needed to get people back in person and find safe ways for people to continue finding recovery from their trauma triggers and from their traumatic experiences. I want to mention that our TransCare division is an emergency medical transportation service, and it's 911 basic life support, just recently, advanced life support certification, and then the behavioral health transportation. And that really is something that I want to make sure people know about, is that when people do need an intensive psychiatric admission under a Baker Act, law enforcement can call us to come and transport the person to a Baker Act facility rather than putting them in handcuffs and putting them in the back of a police car. We don't want a Baker Act. We try everything possible in our service not to put people into a Baker Act situation. But if they are, we believe that having someone who's been trained, just like all of our staff are trained in trauma-informed care and psychological first aid, having someone who's trained, transport them in a van, an unmarked van, to a facility and being able to do a handoff that's humane and dignified is a much better way to have a person get psychiatric intervention than putting them in the back of a police car and transporting them sometimes in handcuffs. And so we've done those Baker Act transports, we still, do 20 or 30 of those a day. And that went up and didn't come down through the time of COVID. And we did, that was not a surprise to us. We expected that to keep happening. So I want to say, just to wrap up, that, there are some places that you can go. I think that people need to know about 211. That's obvious. I'll say that all day. You should call 211 if you don't know anything else to call. But there is a new program that really we're supporting 100%. We're not threatened by other call lines. We got plenty of work for everybody. But this new project is sponsored by Tampa Bay Thrives, which is a consortium of mental health providers who came together and said, what can we do to stop this impact of crisis? How do we help people who need it before it gets to crisis? And so they created a talk line. I'm going to put in the chat. I think I'll do that. The numbers for that, it's called Let's Talk. And it's really designed for people who are not in crisis, but know that they need some service. I'll give you a little example and then I'll wrap up. I got a call literally last night from a board member who knew someone whose 19-year-old daughter had at Florida State University had started having suicidal thoughts and was having a huge anxiety and started to get to the point where she couldn't function at school, couldn't sleep in her bed, couldn't stay, in her room in her apartment, came home and was taken to Grace Point for a Baker Act evaluation. And they didn't think she met the criteria to be involuntarily committed, but she needs help. She's very anxious and again, she's depressed and she's having suicidal thoughts. So what can we do for her? They called a provider and they got a psychiatric appointment scheduled for her in January. Now this young girl needs help now. So this new program that we're helping to start with Tampa Bay Thrives will allow someone to call the talk line. They will take your insurance information, find a provider, and then they will connect you to a provider, and you can make an appointment. The good news is, and this is we're barely starting this, is that while you're waiting for that provider, the Crisis Center of Tampa Bay will offer some teletherapy sessions to help get them through. And we also have a relationship with USF Psychiatry, and we're going to assist with getting psychiatric evaluations through telehealth as well, while they're trying to get connected to a long-term provider. More about that will come out. When it does, I will send it to whomever, just so that people will know what the process is. And I will put the phone number for the talk line, the Let's Talk line in the chat, so that if you don't think you're in crisis or you don't think you really need intensive, help, you can call this particular provider and they'll kind of give you some coping, help you figure out what's going on, and they will also be able to take your insurance and help figure out where a provider might be. We provide services regardless of ability to pay. We take insurances, but we also have lots of funding that's available for people who need us for trauma counseling, especially victims of crime. Sexual assault is free of charge, TransCare is free of charge, and the calling 211 is free of charge. Trauma counseling can be free if someone doesn't have a way to pay.
Thank you, Sunny. That was awesome. Great. And thank you for being such a resource to our community. I mean, your services go on and on and on, just get better and better with time. So everybody, remember, call 211.
Thank you. Thank you, Angela.
You're welcome. Okay, our next presenter this evening is Natasha Pierre, the Executive Director of the National Alliance on Mental Illness. I know she has a personal story, and this lady is always around the community, so you may bump into her sooner or later. Natasha, you're on.
Thank you so much, Angela. It is an absolute pleasure to be with you all tonight. This is something that is, of course, near and dear to my heart, and for questions. I'm absolutely open, transparent, and I'm honored to be sandwiched in between, two organizations that have really been, whether you know it or not, the Crisis Center and Central Florida Behavioral Health have been supports, lifelines, because it has been nonstop since March of last year. By way of a bit of an introduction, I share these things because sometimes I think people should earn the right to speak. So I have some training and education in mental health. I'm an unapologetic veteran advocate, and I've heard that's where my inner pit bull comes out. And there's a personal story connected to that I'll share. But this is a little bit of my background. And I share this, because sometimes people enjoy credentials and certificates and training, but that's not what I think makes me special or unique. I am very, very open about my journey. I am a peer. I've lived with a mental illness, what's considered a severe mental illness, for over 20 years, bipolar disorder, ultradian. It basically means that I can bounce between depression and hypomania several times a day. Post-traumatic stress disorder stemming from growing up in the Virgin Islands and having hurricanes and dealing with thunder and lightning and your roof coming off, as well as for being in New York for 9/11 and dealing with survivor's guilt. Generalized anxiety, that's something that I deal with every day. I'm still symptomatic, even with lashes and makeup. Panic disorder, and EDNOS stands for an eating disorder not otherwise specified. And I share these things because I know that when the mental health conversation, mental illness conversation is being had, no one is expecting me to show up. And that's why I do. That's why I continue to share. This picture down in the bottom, I created it maybe a year or two ago because I wanted people to know that at some of the worst times in my life, a photo is just 1 second. You're seeing a snapshot, a smile. But in those moments, I was feeling a pain and a weight that many people feel and are often too embarrassed to share. I can't help but to be involved in legislation and policy and advocacy. I can't help but do that because my very existence, my mere existence is advocacy. There's so many intersectionalities in my life. And, one of the things I didn't mention on the first slide is that I've actually been in politics, I guess, since I was 14. My first stint was with the Youth for Roy Snyder. He was running for governor on the Virgin Islands. And so I worked with his campaign, and then that led to working with a senator. And I currently have a mayor and a commissioner in elected office right now. So this is something that, being here with you all and my work in mental health is something that is not just a job to me, it is my life. So when we look at the year in review, mental health is health. And that's the message that I've been sharing with many for the last year. March 2020, I was excited, like many people, hoping that this COVID thing would just, kind of go away. It'll blow over. It's not going to be a big deal. We had our open house, and really I was planning maybe we would be shut down for a month, maybe 2. And then it just kept going. And I kept going. And I think a lot of the uncertainty of last year is what led to so many of the, I just call it crisis that we saw. Our calls increased significantly. Inquiries on our social media increased. Our website hits increased. It was nonstop from March until I would say maybe March of this year. I was not expecting the influx. I heard from parents of children who were 6 years old, bedwetting, acting out in aggression, not wanting to leave home. I was not prepared for the number of college students that contacted us directly on the NAMI website, college students that contacted me directly through my social media, dealing with work, school, parents having COVID, roommates having COVID. I mean, not having insurance, I was in shock to the point that I had to lean on some of the community mental health providers that I knew to create group therapy or sliding scales just to meet the need. I heard from a lot of veterans. They entered our support groups. I did our support groups for 7 months, 3 times a week. Veterans who, because of the stillness, were having memories of combat. Retired people who were financially stable, not affected by any job loss at all, but just being away from their families was a challenge. Heard from a lot of people, a lot of women who had sexual trauma, military sexual trauma, date rape, that because of the stillness, once again, these memories are coming back, many of whom had never reported. I heard from seniors who were concerned about their families and about getting sicker and about not being able to afford medicine. Our support groups were I just call it a jambalaya. People from every walk of life, every religion, every ethnicity were in our support groups just to share. And sometimes, especially in the beginning, it wasn't about a mental illness because COVID did not create mental illness. COVID created a mental health crisis in this nation: stress, overwhelm, frustration, fear. And the one thing that I am not hearing people talk about enough is grief. In this nation, we've lost over 700,000 people, and that's only to COVID. What about to cancer, to suicide, to accidents, and to all of the other reasons why people die? We're a nation in mourning. And in our support groups, we were seeing that. As time went on, of course, we heard more about people having a resurgence of symptoms. For myself, that mask was a challenge for me because I got panic attacks. So I had to come up with ways to go to the grocery store or to be out in public with a mask on without having a panic attack. NAMI, we are the nation's largest grassroots mental health organization. We've got 600 affiliates across the nation, city, county, state. We even have affiliates in the Virgin Islands, where I'm from. And we focus on 4 very key areas: education. So we've got courses for family members as well as the individual living with the diagnosis. And let me tell you, last year and this year, education has not been in demand. It has not been. We've been trying to have courses for the family members. It's hard for them to take the course because they're home with their loved one that has the mental illness. And really right now, people just want to hear that they're not alone. So our support groups for the family members, as well as the person with the diagnosis, is where we've seen the most traffic. Of course, we are advocates. We're advocating locally, statewide, and nationally, and we're going to continue to do so because people living with a mental illness or affected by mental illness should also have a chance to lead and to enjoy a fulfilling life. And our public awareness, like, things I'm doing tonight, and I'll do that wherever, whenever, just let me know where you want me to be and I'm there to speak, because we know that there are people being affected by mental illness and they're not talking. They are living in pain, suffering in silence. They're existing in a silo. And we know, and Angela, thank you for inviting me to the meeting last week, because that meeting has been on my mind since I left and has sparked several conversations and several initiatives that have already begun. And I'll tell you about those in a bit. But we know that there are segments of our population that experience mental health differently. I can tell you 100% certainty. The only reason why I'm here speaking with you tonight is because I had great insurance at a time when I needed it most. I was able to get into an intensive outpatient treatment program and to be there for 3.5 months, 9 to 2, group counseling, individual counseling, medication management, understanding my diagnosis, understanding symptoms and how to cope. I was able to get that. But the reality is the vast majority of people who need the treatment that I got will not receive it. And that's why we advocate. One of the segments of our population that I heard a lot from last year, especially around the time of George Floyd, were our deputies. You know, I am in NAMI Hillsborough, and I am a part of their crisis intervention training curriculum. And I was surprised and grateful that they felt comfortable to reach out to me. And it ranged everything from help me understand why people are so enraged to help me understand what to tell my wife when I leave home. These are the calls that came to NAMI, that came to me, that came to my social media. And, you know, when we say mental health for all, we're not just talking about only this group of people, only this industry. It's for everyone. It's for everyone in Hillsborough County, in Florida, East Coast, the nation, the world. Health equity, stat, 55% of US counties do not have a psychiatrist. 55%, over half. And so we've got populations in our country that don't even have access to receiving a diagnosis. A diagnosis for me was very bittersweet. It gave a name to what I had been experiencing, but also it ushered in, you know, self-stigma. You know, and for a lot of people in our country, they still don't have the opportunity to have a name of something that they can research. We're hopeful the 988 National Suicide Prevention Lifeline, that's going to hopefully take effect around July of next year. This is going to be a direct number that many people are going to be able to call if they're in a behavioral health, mental health, substance use crisis. And we're grateful for that. And so these are one of the things that we advocated for. You know, when it comes to public awareness, we know that storytelling saves lives. I know that I can help and impact more people by sharing my story than by reading them what a textbook says. And there is importance in reading what the textbook says. But what I found over the last 18 months is that the biggest barrier to people seeking help is stigma and self-stigma. And whether you are in a family that thinks you should just pray it away, you know, just fast and pray, or you're in an environment where they think you just need to, you know, cleanse your gut and purge, or you're in an environment where I often find myself where it's like, well, you know, how bad could she be? She's talking to the League of Women Voters. We know that it's important for us to continue to have these conversations, and I'm so grateful to be here tonight because it's saving lives. Letting people know that you're not alone. You're not the only one feeling anxious when you leave home. You're not the only one concerned about going back to work. You're not the only one that is in active grief. And sometimes, you know, people want to be a guru, a life coach when they're being supportive, and that's not necessary. We just need you to be present. Support isn't always, you know, hey, you have nothing to be depressed about. You know, you got a new car, you just got a raise. No, sometimes support is, I'm so sorry that happened to you. That sounds awful. That's probably hard on you. What can I do to help? I'm going to check on you later tonight. You don't have to talk. I'm just going to drop off some Chick-fil-A for you, and you can open up your door and grab it. We just want people to be present and to have the conversations, because hurting in a silo, in my experience, causes people to lose their lives. Hurting in a silo, suffering in silence, leads to decrease and diminish hope. And if anything people need right now is they need hope. They need hope that tomorrow will be the day that a job calls me back. Tomorrow will be the day where, you know, I have insurance. Tomorrow will be the day where I can fall asleep and remain asleep through the night. That tomorrow will be the day where I am less paranoid, or where I'm able to keep food down. As long as we can fuel and empower hope in our communities, we have a chance to reduce the number of people who take their lives. And, you know, I've heard it many times that, you know, people who die by suicide, you know, they took the easy way out. As a person who has had suicidal thoughts as a person who has been suicidal. That is not true. When that's an option for you, you've run out of options. You've run out of hope. You are hopeless. There's no way life can change. And I keep telling my story and the work that NAMI does and all of our community partners, we do it because we want to get to someone before they make that decision, before they have that plan. When we say mental health for all, it's all. It is every race, every religion, every ethnicity, every industry, every socioeconomic status. Angela, this is, I'm going to credit you with this. NAMI, all of the NAMIs in the Tampa Bay area, Hillsborough, Pasco, Pinellas, and Polk, we did a joint mailer for all of our counties. And so starting tomorrow, there's 10,000 pieces of this Stronger Together mailer for NAMITampaBay.org with some information on how they can connect with us, going out to some of the hardest hit areas in our county. And one of those areas is East Tampa. I have had several conversations since the meeting last week about how we're going to ramp up support in East Tampa, in Seminole Heights. The data shows that those are some of the areas with increased opioid use, suicide calls, homelessness, and we are grateful to some of our community partners like Baycare and Advent Health that's going to help us do that. Our goal is to get the information out. Being the best kept secret when it comes to mental health is not something that we want to do. So we are everywhere your eyes are, and this is a way to contact us. But when it comes to mental health services, it's my job to get the information out. It's my job to ensure that we are advocating and, doing that public awareness, and we've got the courses and the support groups available. But I remember, I still have, let me make sure it doesn't go off. I still have my alarm set from, the last Baker Act that I had that reminds me to take my medicine. And I haven't needed it in many years, but I keep it set to remind me. I never, ever want to lose sight of or forget what it was like to be in crisis, because I never want to be that disconnected from the people that I serve. And I'll tell you, I think because of what I've been through, I'm able to spot it in others. So from conversations in Publix, where, I just linger around the ginger or sweet potatoes a little bit longer just to strike up a conversation, and without fail, they always say something that's like, oh, so what medicine are you picking up? Or, interesting, you just got out of the hospital, COVID? No? Then it's something about depression, anxiety, and now we have a conversation. Crisis Center of Tampa Bay, you have been an overflow for us in terms of calls. We've received more calls than we've ever had in the history of the organization. Central Florida Behavioral Health Network, providing the resources, has been, you're a go-to for us. And now with Tampa Bay Thrives, the work that they're doing, being able to actually connect with a voice, connect with someone who can walk you through the system of care, connect with someone who is going to return your call and take you seriously. I can tell you, many people living with a mental illness and who are experiencing a mental health crisis, they're patient. They just want to know that someone cares. And so I'm grateful again to the League of Women Voters for having this forum tonight, for helping us get the word out, for sharing resources. NAMIHillsborough.org. We're always looking for volunteers, because now what we're doing is we're creating groups, support groups for different communities, for veterans, for teachers, for parents who've lost children to gun violence, for 9/11 survivors. That's what we're doing. And we're going to support and advocate and outreach until it's no longer necessary. Thank you.
Thank you, Natasha. And, you know, to hear your personal story is just it's so wonderful that you're able to overcome, you know, the issue that you face every day. And just in case you're wondering what meeting Natasha was invited to, it was the East Tampa CRA meeting. And there were some survivors of gun violence there, unfortunately. So that area of Hillsborough County is dealing with poverty, violence, unemployment, and that's every day of the week, and with COVID on top of it. So thank you for the work that you're doing, and keep it up, and put anything that you want in the chat so that people can know how to get the resources that you're offering. This is a powerful program today. Thank you, speakers, for showing up. We really, really appreciate you. Our next speaker is going to be Mr. Davidson, and you are on.
Sorry, you would think after like a year and a half of this, you would figure out that you have to unmute yourself before you start talking. So let's try this again. Hey guys, I am Alan Davidson. I am the Chief Clinical Officer for Central Florida Behavioral Health Network. Let me just explain a little bit who we are and what we do. We've been around since 1997, but really came into our fuller self around 2010. And that's when then Governor Scott basically broke apart the Department of Children and Families. And so one section of the Department of Children and Families is the more of the child welfare section. And then the other part of the that he broke apart is substance abuse and mental health. And that's what we do. Our budget is around $220 million a year. Now there are approximately 7 managing entities in the state of Florida. We are the largest in population and the second largest in landmass. We go from Pasco County, so up around Wesley Chapel, all the way down into Collier County, over into the Everglades, so Hendry and Glades County, and then up into Polk, Highlands, and Hardy. So we cover a large swath of people. Our purpose is to really ensure that those people without any insurance, or those people who don't have any means to get behavioral health services, are able to do that. We do that with our small but mighty staff of around 65 people, and we serve a lot of different programs. It's always good for me to do these programs, to go back and kind of look and think about all the programs that we do. So kind of piggybacking on what Nami was talking about, we are bringing up some RCOs, which are recovery community organizations based with peers who do services. We got some substance abuse stuff. We work a lot with our behavioral health providers here in like Hillsborough County. The Cove actually just rebranded themselves. They used to be DACO, now they are the Cove. Axe, Grace Point, Northside. So we work a lot with them and their CSUs and detox, really looking at those high utilizers of services just to see what we can do to come alongside those people, work with the staff who are in those providers, and try and ensure that they don't come back into services as well. We also deal with a lot of our more serious mentally challenged individuals who are in the state hospital or who come out of the state hospital, and we again work with our providers to make sure that they don't go back into what we call deeper end services. It's really interesting as we kind of bridge into the topic I'm going to talk tonight about is COVID and the senior or the aging population. It's really interesting that Sunny talked about COVID as a hurricane, because I've referred to COVID as Hurricane COVID ever since it came around. It's just a long hurricane that didn't go away and that affected a whole lot of people. And what was the difference between a hurricane, well, one of the differences between a hurricane and then Hurricane COVID is that a hurricane might come into, let's say, Southeast Florida, Miami, and those in Southeast Florida can go to the Panhandle and they're away from the hurricane. That wasn't possible with COVID. Everywhere you went, whether it was the grocery store, the post office, your work, dropping your kids off at school, it was around. And it was really interesting hearing about the next pandemic being mental health. I unfortunately, business is good right now in mental health. We have a lot of work to do with mental health and how we come alongside of it and how we work through it. We actually had a staff member recently at our organization, take some time for that. And I thought it was actually really courageous of them to do that. So next, if you go to the next slide, we'll get into some seniors and mental health. So our two goals today that we're going to look at really is understanding the symptoms and risk associated with common mental health problems as it relates to our senior population, and then being diligent and observing and communicating changes or symptoms to the appropriate healthcare individual. It takes all of it. It's going to take a village, as we often say, to work with our senior population. Because if you think back to our senior population, and I often refer to them as my grandpa, he passed away last year, not of COVID, but of just a long life. He was 97 years old, fought in World War II. And he didn't know thing one about mental health. But if you think back to World War II, that's where a lot of our mental health disorders kind of got their name. PTSD, or post-traumatic stress disorder, wasn't post-traumatic stress disorder in World War II. It was battle fatigue. And so they didn't know that. And so as we look at some of our our aging population, trying to really be diligent in educating them and coming alongside of them, because they're a tough population to work with. So tough in that they're really resilient. They come through a lot, and so working with them as they kind of go through some of their aging issues as it relates to behavioral health. So next slide, please. We talk about this a lot, but then to see it in a graph is rather spectacular. This is the aging population as it is today. When you reach 65 years old, you have and a guy, you're going to live for 19 more years, and if you're a woman, you're going to live for 20 more years. As you look at some of those other statistics, approximately 9.3 of the total population of individuals over 65 live below the poverty level. It's pretty tough. One person gave me a statistic not too long ago that if you reach 60, and this was actually even about a decade ago, that if you reach 60 today, you have a 50-50 shot of making it to 100. Just kind of like let that sink in for just a second. If you reach 60 today, you have a 50-50 shot of making it to 100. And why? Modern medicine. My mom is 73 years old. And when she was around 35 years old, she came down with rheumatoid arthritis, and in the process of trying to heal the rheumatoid arthritis with what they called gold shots at the time, they ruined her lungs. She's been on oxygen ever since. She is 73 years old and has been on oxygen and really can't get around since she was 35. Modern medicine, it's there. Technology. I mean, think about these things that we hold in our hand. My wife says that this thing's attached to my hand. But these things, our phones that we have, our watches that we have. I mean, think about that you could equip your loved one who is a senior with a watch or with a band that would tell you everything that's going on with them, that you could see their vital signs from their house to your house. Modern society, just as we get around, think about for a second your maybe your parent or grandparent that they don't have to go to the grocery store anymore. If they can get halfway taught or they are tech savvy, they can have groceries delivered to their house every day, all day, and never have to go anywhere. We have ALFs, nursing homes, home care that have really ramped up and done a really nice job with our senior population, and then government assistance. It's really better than it's ever been before. for our aging population. Next slide, please. So this is where we really get into talking about some of the behavioral health issues or mental health issues with our senior population. It's if you ever get a chance, and you're kind of, I've really gotten into YouTube over the last couple months and really went and kind of head first into YouTube. But there are tons of videos about the villages up in Leesburg and what they're going through. If you think about the villages is just now getting to a point where they're actually building memory care centers. If you think about the villages and how long it's been around, they're just now getting to that point. So that those people who came into the villages at the beginning are now getting to the point where they need some more kind of long-term mental health care. So that, like cognitive impairment, substance use is actually pretty rampant among our senior population. Pretty rampant. I mean, if you think about, especially the males, the males, they work for 30 years, and that population, they work for 30 years for some company, and then they retired. And a lot of them, they worked long hours, hard hours. They were really resilient and diligent at working, and then they stopped. That was it. Poof. They were done. And they might have traveled for a year, and then that's that. And then that beer or two after work turned into a case every day. And so substance use, primarily alcohol, is pretty big, but you'd be surprised at the cocaine and methamphetamine use among our senior population. And a lot of these things lead to things down there at the bottom, like bipolar disorder, dissociative disorder is so rampant, and it's so misdiagnosed in the senior population. That most doctors overlook that elderly women with a UTI start to experience psychotic symptoms, and it could be easily treated as a UTI. Post-traumatic stress disorder, where the boomers and the senior population that fought in the Vietnam War are there. They're 70 years old right now. They're 73 years old, something around there, 75 years old, and they're in full retirement, and some of them are experiencing post-traumatic stress disorder. Next slide, please. And this is where we really get into how COVID, what did COVID have to do with our senior population? As we just look up there on the top left, chronic pain, chronic disease, physical impairments, thoughts, physical disability, loneliness. Wow. I mean, that's if you overlay COVID, all of that. And then the next slide, we're going to talk about this a little bit more, but if you start to overlay COVID with a lot of these things, really starts to take some impact here. And then life changes. These are the things that start to trigger, are triggers for anyone really, but for our senior population, that really starts to trigger some, mental health issues like, retirement, they're retiring, widowhood, whether that's for the guy or for the lady. Their role in family changed. Maybe they were the decision maker now, and now they're having decisions made for them. They don't get out as much. People kind of take our workforce or your work family for granted sometimes until you don't have it. And think about if just like you just had your wife or your husband to talk to all day, every day, and you didn't get to go to work and talk to all your kind of coworkers and talk about kind of social events. And then, dementia starts to come on for some of our seniors, sometimes earlier than others. Next slide, please. So this is where we really start to talk about the overlay. Think about for a second, and I put this down, and then because I really want to kind of start to overlay some about whether it's natural or forced due to COVID. So retirement. Did you retire? They're calling it the Great Resignation right now, and I think just as the media and talking heads are talking about as it refers to some more in the younger population. I mean, think about that lady or guy who's 58 years old. and retirement comes, and they were thinking about doing it naturally at 62 or 65 or 70, and COVID comes, and they're like, nope, I'm done. I'm gonna go to the villages. I'm gonna go to Sun City Center. I'm gonna go to my daughter's house in Georgia, and that's where I'm gonna live. And then think about how that affected them as they were maybe forced into retirement due to COVID. Widowhood. How did that really affect our senior population? Maybe they had just lost a spouse pre-COVID. Maybe let's say January of 2020, they lost a spouse, and then COVID hits in March of 2020. And then they lost all their friends after that because they couldn't really socialize. Or March 2020, let's say May 2020, they lose a spouse due to COVID. And then they're without their spouse that they might have had for 10, 20, 50 years. And we talked about in the previous slide, the role in the family changed. Maybe they came down with COVID somewhere during that process, and they were no longer kind of a stout, strong man or woman, but they had to be taken care of now by a caregiver, whether that was in a nursing home or by a loved one. And think about someone who's really autonomous their entire life, and then boom, that kind of probably shocks them quite a bit. And then moving, after my grandpa died, he died close to Labor Day of last year. And my mom and my dad, it was my mom's dad, they had lived next to each other since 1977. So they were across kind of we're from Lakeland over in Polk County, and they lived kind of across the field from each other. And once he passed away, they moved over closer to me and my wife, and now live in Apollo Beach. So after living in their house since 1977, they moved. Not because of COVID, but because of my grandpa passing away, and they no longer had any kind of caretakers over there in Lakeland. And it's been stressful on them to be in one house since 1977, move during a pandemic, not know anything about Apollo Beach. And those of you who know Apollo Beach, it's getting to be a bustling little town down there with 41 kind of roaring through it. And they grew up, and lived on the north side of Lakeland, where the road they live on is still a 2-lane road today. So big changes for them, and a lot of stress factors for them. And again, my mom and dad would never say that they are stressed out, but they're stressed out. I can tell that they're stressed out as they go through that. So as you think about the overlay of life and changes in COVID. So next slide, please. And then these are some of the effects. If you overlay, you think about that loneliness, suicide. As Sonny was talking about, suicide's huge. And I'm really hoping for that 988 line as it comes on and gains some steam. Some of them, proportionally, the financial hardship. This was big. I was talking to one of my colleagues about the lack of specialized healthcare. If you think back to COVID and the senior population, if you have a heart problem, you're not going to go to a podiatrist. You're going to go to a cardiologist. The same for the elderly. That's a specialized care and a specialized set of skills that you need to work with the elderly population. And guess what? They weren't able to get out during COVID. They weren't, even if they were maybe in a nursing home or an ALF, doctors weren't really coming in. And so they lost all of that specialized healthcare during COVID that they were normally getting pretty readily, whether on their own or coming to their house. And then the lack of assistance with daily activities, that stopped too. It stopped for everybody. And a lot of us who are very mobile and able, that maybe that didn't affect us as much, but for the senior population, affected us quite a bit, affected them quite a bit. So as we think about our elderly population, and how to remain some resilience, the elderly people who, and this is still today, we talk about I was reading something the other day, because in our world, in my world that I'm in, I'm a little more in the political world. I was up in Tallahassee last week talking to some of our providers in our region, and then talking to some legislators. And they say COVID's done, but it's not done. Go to any hospital and tell me that it's done. This time, legislation is just now getting going in Tallahassee. There are just a few bills right now going through Tallahassee that have anything to do with COVID, and they are not expected to have any chance of passing. So Tallahassee has essentially moved on from COVID from a legislative standpoint. But COVID is still going. And so as we think about our elderly, these are some of the things to do, to maintain some resilience, establish some routine and structure, remain cognitively active, do some stuff, whether it's card games or if you're tech savvy, for your mom or your dad, or your grandparent, that they can get on the computer and play solitaire or something, exercise, try and find a therapist, whether that's online. A lot of good therapists, like Sonny was saying, NAMI has them. This telehealth is booming. That's one of the good things about COVID is telehealth is here to stay. And so we don't have to be able to get to a therapist, especially for some of our lower socioeconomic families and elderly, like in East Tampa, like in Tampa Heights, who don't have, think about having to hop on a bus for 4 hours round trip to see a therapist for 45 minutes. That kind of makes it not worth seeing a therapist in my book. That's a pretty tough road to have to go through to see a therapist. Meditation. A lot of these communities, senior communities, have set up some of these things like meditation for their senior population. And then if you have a substance use issue, that you're trying to manage that as well. Next slide, please. And we'll go one more. So these are some of the resources for seniors. Or senior friendship centers, outpatient services, in-home on-site programs. So that's meaning like therapists that will come to your home. That's more and more and really ramped up. It's kind of piggybacking. It's a nice marriage where our therapists now are wanting to work remote, and they're able to do that by doing some of these in-home therapy sessions. So, and then private practice therapists, and then being able to get back out to geriatric doctors who specialize with our senior population. I think we got one more slide here. There we go. And it takes a village, guys. It takes all of us to work with, whether it's NAMI, whether it's, Crisis Center, Tampa Bay, who's going to step up, who's going to volunteer to help with, whether it's our seniors, the first responders, those who are experiencing suicide, those who live in East Tampa or Tampa Heights, and, who's going to do that. So thank you very much for giving me the opportunity to speak about our aging population. It's very present for me right now with dealing with my mom and dad. So thank you.
Thank you so much. We know that we live in the state of Florida. So not only do we have a lot of seniors here, more are coming. So this is a very, very important issue. I myself work with seniors on a regular basis, helping them transition onto Medicare. So I also put my name in the chat. So if you have a senior who's experiencing difficulty with Medicare, Medicaid, please feel free to contact me. Now, speakers, don't go away because we have questions. We have some lovely ladies who are looking at the chat. Mary Switzer, you want to say a special thank you to Mary for putting this whole program together. And we have Carol, who is looking at the chat. So, and I believe Teresa Potter. So we have some great volunteers who are helping us this evening. Do you have any questions for the speakers?
So there are two questions in the chat. I'll take the first one and leave the second for Teresa, but they're both actually related. Perhaps Alan wants to start with his recent visit to Tallahassee. The first question is, are your organizations anticipating increased funding from the state for mental health services, especially with all the statistics and information provided? It seems that there's a need there and maybe perhaps an openness to a new approach. How would you read those tea leaves?
So, $1 million question right there, right? There is a lot of funding coming down. Florida is flush with funding for behavioral health services right now around the state, not just here in the Suncoast area or Hillsborough County. The issue is infrastructure. Just to be kind of I'm just a straight shooter. The infrastructure, and then we have an employee crisis right now. So, if I'm gonna pick on Sunny or a crisis center, if I gave Sunny $10 million, she would say yes, but then how does she go find the staff to build a program around that? So it's a catch-22 right now, and so that's our struggle. It's for once in my career at Central Florida, I can say yes, we are not an underfunded system. We have plenty of money right now. We're just struggling to find the capacity and staff capacity and organizational capacity to thoughtfully spend that money.
So
Any other comments on that question?
Yeah, there's a lot happening in Tallahassee, and part of our goal with NAMI is to ensure that the voices of people directly affected by mental illness is heard. We are huge proponents of certified peer recovery specialists being involved in the system of care. And that's people who have the lived experience, whether it's substance use or mental illness, that can be on site for when someone is being Baker acted or is entering a detox facility or is working at a hospital or is, working with insurance. We know that there is value in having people who've already been there, who've been through, and who know that recovery is possible to be in that journey. We are and have been and will continue to advocate for supportive housing. One of the things that Florida just simply does not have is enough supportive housing. And supportive housing would be, if you break your hip, you go from the hospital with your surgery, and then you go to a rehab before returning home. You got to learn to walk, maybe take care of your wound. Well, after you are Baker acted, you go back home. There's no in between. There's no step down. There's no supportive housing. Let me help you understand your diagnosis and how to live on your own. And so we see a lot of people repeatedly going through that system of Baker Act and back at home because they're just not getting that in between support services that they need. We're going to continue to push for parity, health parity, ensuring that mental illness is covered as well as physical illnesses. So that's some of the things that we advocate for locally. We're working with the Florida Mental Health Advocacy Coalition. They've got an advocate and lobbyist in Tallahassee. So we are very mindful of what's going on, and we're grateful to have advocates like Senator Roussan and of course the First Lady Casey DeSantis, who is as passionate as we are.
The second question that was related was just, is there any current legislative discussion happening about any of those issues that you already mentioned or any other, and or how can we keep on it as the legislative session goes forward, I think would be that next question.
There's a couple things that we're looking at. Of course, continue looking at 988. Senator Roussan introduced the peer support bill, and I think he's going to reintroduce that. So we're monitoring that. Of course, we're looking at ending the death penalty for people with severe mental illness. It's already on the books for people with cognitive disabilities, but we'd like to see an end to the death penalty for people with severe mental illness. Looking at things like ending solitary confinement. And what I've learned in the last 18 months, there's plenty of money to go around. There's plenty of money to do what we need to do. And so our job as advocates is to ensure that the decision makers, the check signers, are aware of how dire services are needed on the ground, so that the Crisis Center of Tampa Bay and Central Florida Behavioral Health and the NAMIs, who are actually working with the community every day, that we have the funding that we need to ensure that truly we're not just saying you're not alone, but we have the manpower and the resources to ensure that people really feel that.
On a different subject, there's a question, a concern actually, and I think we all are concerned about youth. A number of you spoke about the increase in risk and symptoms and so on, incidents with youth. How would you suggest that we help to build resilience for young people?
Yeah, I'd like to address that if you don't mind. That's a really common question, resilience. We have a youth in transition program. I just want to mention it again, who works with youth who are transitioning to adulthood, ages 15 to 24. You can access that by just calling 211 and saying you want to talk to somebody in youth and transition. What we're talking to parents about is resiliency is built on connections. There's research all over the place that says even people who've experienced trauma, if they have a connection with a loving, trustworthy adult that is unconditional, that will be the beginning of resiliency. A lot of kids have experienced trauma, but when they have that relationship with a trusting, loving adult, that begins the process of rebuilding, literally rewiring their brain mechanism so that they do decrease the triggers. In other words, their amygdala, which is the thing that makes us flee or fight, is literally on fire when they're triggered and traumatized. And by having those relationships, it starts to rebuild a sense of trust. The other thing that we've been talking about a lot is structure. We get stuck in our own stuff, especially in COVID. We get lethargic, we get lazy, we get used to things. It's really about taking our kids, having opportunities to take other kids or give kids opportunities to experience leisure activity, recreational activity, physical activity, and then establishing those trusting relationships so that you can ask those questions. And that's the last thing we talk about is don't be afraid to ask the questions. The mom that I talked to today was brave enough to ask her daughter the questions about suicide, the questions about depression, the questions about what's happening, and not be afraid that if you ask, oh my God, you're going to plant the idea in her head. That is not possible. That is not possible. You will not plant the idea. So those are just a few things. And then finally, giving ourselves some grace and also giving our kids a little grace. If we're going through all of this, imagine what it's like for them. I don't remember really when I was 16. I do actually remember when I was 16. That was almost 50 years ago. And everything in the world revolved around everybody else, my friends, my activities, and nothing to do with my family. But at the end of the day, my family is the place where where we're going to come home to. And for kids who have a family, we have to be willing to give them grace. And for those that don't, or come from a trauma history in their families, there are other adults that can provide that. And Natasha mentioned some of the work that's going on in East Tampa, and that's a great example of that. There's some amazing things happening for people who are taking on mentorships and tutoring and becoming that loving, trusting adult for a young person.
I think Sunny hit it on the head with relationship. That's exactly what I was going to say. It's really hard to build relationship by yourself when you have no support. So one of the things that I tell parents is do not be your child's first bully. Don't do that. Hear them, listen to them, feel with them. We can no longer go to the stories of when I was your age. Well, the world has changed. There's no social media when I was in high school, and likely not for the parents. And so don't be your child's first bully. Listen to them. They're experiencing unique things in schools and online. And, my personal opinion is I don't think, children should have social media at all, but, that's just my thought. The other thing is, I have one of my roles, my efforts is to take things out of the school. I think our schools are overburdened. Just speaking with some of the guidance counselors, like they are overwhelmed, just handling regular day-to-day school stuff. And so a lot of the conversations, we really can't lean on teachers to do that because they're already doing a lot. But what about the AAU teams? I don't know about you all, but I knew that during COVID, I thought those would shut down. They were still traveling, they were still playing. And, that's actually been an entry point for me to speak to children and their parents about mental health and about leadership and resilience and what it means to really be a leader on and off the court or field. Resilience isn't built just by yourself. You've got to have something to be resilient for. And many of our children, unfortunately, have already experienced traumatizing events that have tested their resolve and their resilience. But the message is, exactly what Sunny said, develop the relationship. Don't be your child's first bully.
There are not any other questions in the chat. Does anybody else have a question?
If there's no more questions, I'm Lori Winkles. I co-chair the Healthcare Action Group for the League of Women Voters. I'd like to thank our 3 speakers this evening. Wow, this has been so insightful.
It was
This has been
amazing.
so helpful. We are so impressed. This is just the beginning. The League of Women Voters works to educate and inform, and we have these presentations to do just that. We make them free to our community so that we can make people more aware. And together with people and with organizations like you and with the League of Women Voters, we're really being successful. So I thank you. I look forward to the next. If you want to know when we're going to do next, go to hclwv.org. That's our website, and we post all the time the different lectures that we're presenting to the community. So to all of you for joining us, thank you. And to our 3 speakers, thank you, thank you.
Thank you.
Have
Thank
a
you.
lovely night.
Thanks, everybody.
Thank you so much.